More and more people can now get those shots. Tonight we're taking a look at, let's call it the other end of that syringe, and hearing the stories of 3 women who've been administering the vaccines in Rochester. Here's ABC 6 News reporter Rachel Mills, who found their work is critical and sometimes emotional. Rachel.
Ross, I'll be introducing you to a few of the healthcare workers actively putting an end to this pandemic. Karen Moyer and Sadie Swenson both work for Olmsted County Public Health, and Glenda Morris came out of retirement to volunteer at local vaccine clinics. I'm going to let them tell their own stories about delivering this life-saving vaccine.
I jokingly say it makes me feel like I'm a useful part of society again. I'm a retired nurse practitioner. I've been retired for about 5 years. My daughter and son-in-law, she's a pediatrician and he's an ER doc at Mayo. When they got their vaccines, I called Olmsted County Public Health to see if they needed help with vaccinations. Well, less than 3 days, I was getting a phone call or an email. Can you come in and help us with our mass vaccination clinic in early February?
And I started out with doing shifts at Graham Park, which was the testing site. Then we started the vaccine clinics, and so then I was trained to take part in the vaccine clinics. So I have to say the county has just been fabulous in giving us the amount of training that we need, because being a vaccine nurse is not my typical day job.
This is part of our job right now. So our regular job, we are still doing that, but on a scaled down. I sometimes work a clinic once or twice a week, and usually that's about 5 to 6 hours.
So it's like 5 to 6 hours on your feet. So I made sure I wore comfortable shoes. And when there was an opportunity to sit down, sit down.
I'm really proud of being a part of that, because I feel it is part of the solution.
I had a person who wanted to give his vaccine to somebody else. So he qualified based on his tier, and he had a friend who didn't qualify yet. And so he wanted to give his vaccine to her. And that was so heartwarming, that he would want to do that. It's something that we don't have any control over here.
The other thing that I really liked about doing this, because I'm new to Rochester, it gave me an opportunity to meet people and network with other, nurse practitioners, other nurses.
Last summer, we shared flowers from our flower gardens, and a couple of us got together that I would have never met had I not been at Graham Park.
It feels good to be at this point in the pandemic response, because it feels like we're getting towards the end.
Yeah, it's pretty amazing. And the first day I was there, I was taking a break, and there was a public health nurse that was sitting near me, and she was saying that Olmsted County did a mass disaster drill.
I remember we did I think it was a flu vaccine, but it was in preparation for having to give mass vaccinations. And here we are 3 or 4 years later doing it for real.
A lot of thank yous. Thank you for helping. Thank you for your service. So that felt good. Thank you for giving your time.
It's a really exciting thing to be able to participate in.
They know it's history. They know it's a matter of life and death. And they know that what they do is helping so many people feel safer. And as you heard, they just say it's their job. I wanted to tell you their stories because when you go and get your shot, remember to thank the person who fills that syringe and sticks the needle in your arm. It's important to them to hear that. Ross.